Hey everyone! Today, we're diving into the world of liver and gallbladder health. In this video, you'll discover amazing foods that cleanse these vital organs and tips for preventing liver disease. Stick around until the end, and don't forget to hit that subscribe button for more health insights. Our liver and gallbladder play crucial roles in filtering our blood, which carries various substances like toxins, bacteria, and fungi. Over time, exposure to harmful substances such as alcohol, strong tea or coffee, food additives, prescription drugs, pesticides, and city pollution can weaken the liver. Overeating, especially animal fats, and constipation can make things even worse by overloading the liver. You can support your body's natural cleansing process by incorporating foods that help the liver function optimally. Stay tuned to learn about these powerful, liver-loving foods. 1. Grapefruit. Grapefruit is a powerhouse fruit packed with vitamin C and antioxidants. It naturally kickstarts the liver's cleansing processes. Just one glass of fresh grapefruit juice can jumpstart detoxification and encourage the liver to produce more enzymes. Add this refreshing juice to your daily routine to support your liver's health and vitality. 2. Avocado. Avocado is fantastic for liver health because it helps produce glutathione, essential for detoxifying the liver. Regularly eating avocados can significantly boost liver function. They're packed with amino acids, nutrients, and trace elements that protect and support the liver. Avocados are also rich in fiber, which aids digestion, and antioxidants that help the body eliminate toxins. These creamy fruits are a great source of healthy fats, like omega-3s, which lower bad cholesterol and reduce the risk of heart diseases. Plus, they help fight inflammation throughout the body. 3. Apple. Apples are a simple yet powerful fruit, integral to many healthy diets. Renowned for their benefits since ancient times, apples support both the gallbladder and liver. They are rich in pectin, a type of fiber that cleanses the intestines and liver of toxins and prevents constipation by stimulating bowel movements. Eating an apple a day can increase good cholesterol and decrease bad cholesterol, which helps prevent plaque buildup in blood vessels. Apples aid the liver in processing bad cholesterol and removing cancer-causing toxins from the blood. This detoxifying effect is enhanced by malic acid, which is abundant in apples. 4. Citrus fruits. Citrus fruits, brimming with vitamins, offer numerous benefits for our bodies. They enhance liver function and reduce inflammation, thanks to their rich content of essential oils and vitamin C. This vitamin not only protects against colds and viruses by boosting our immune system but also helps eliminate harmful substances from the body. Fruits like oranges, lemons, and tangerines improve digestion, making them a delicious and healthy addition to our diet. They are particularly beneficial for liver health and detoxification. 5. Olive oil. Olive oil is rich in healthy fats and essential nutrients, making it a fantastic addition to your daily diet. It keeps liver cells functioning optimally, thanks to its abundance of antioxidants and anti-inflammatory properties. Olive oil aids in detoxifying the body and removing harmful substances from the blood. The healthy fats in olive oil also lower bad cholesterol, helping to keep blood vessels clear and reducing the risk of heart disease and other cardiovascular issues. Additionally, olive oil contains vitamins and amino acids that protect cells from damage caused by free radicals, thereby lowering the risk of cancer and other chronic illnesses. 6. Cruciferous vegetables. Cruciferous vegetables, especially broccoli, are outstanding for liver cleansing. Including broccoli or cauliflower in your daily diet boosts the body's production of glucosinolates. These natural enzymes activate detoxification processes, reducing harmful substances and lowering cancer risk. The antioxidants in these vegetables not only help reduce the chance of cancer but also assist in removing toxins from the body. The healthy fats in olive oil also lower bad cholesterol, helping to keep blood vessels clear and reducing the risk of heart disease and other cardiovascular issues. Additionally, olive oil contains vitamins and amino acids that protect cells from damage caused by free radicals, thereby lowering the risk of cancer and other chronic illnesses. 7. Tomatoes. Tomatoes, packed with lycopene and amino acids, are great for liver health when eaten regularly. These nutrients get absorbed into the bloodstream, enhancing liver function and aiding the body's detoxification processes. Tomatoes also contain glutathione, which actively supports and improves liver function. Rich in flavonoids and beta-carotene, natural antioxidants, tomatoes boost blood flow in the liver and protect the body's cells from damage by free radicals. 8. Walnuts. Walnuts are packed with the amino acid arginine, which helps the body remove toxins like nitrogen compounds and ammonia. They're also high in fiber, benefiting the intestines, and rich in omega-3 fatty acids, which support liver health by aiding in blood purification. Eating a small handful of walnuts regularly can lower bad cholesterol and provide the body with healthy fats. Not only are walnuts nutritious, but they are also essential for maintaining liver health and supporting overall body wellness. 9. Garlic. Garlic is a fantastic natural cleaner for the liver. Even just 1 or 2 cloves can help eliminate harmful substances from your body by boosting the activity of liver enzymes. Rich in allicin and selenium, garlic is excellent for aiding liver detoxification. Adding garlic to your diet is an easy and effective way to support liver cleansing at home. 10. Green tea. Green tea is excellent for liver cells due to its high content of plant antioxidants called catechins. These catechins assist the liver in handling toxins and harmful substances, thereby supporting its overall function. 11. Broccoli. Broccoli is not only rich in beneficial micronutrients but also high in dietary fiber. This helps restore bowel movement and cleans blood vessels by lowering bad fats, reducing the risk of heart problems. This vegetable is also packed with vitamin E, a fat-soluble vitamin that our bodies cannot produce. We need to obtain it through our diet. Vitamin E is a natural antioxidant that safeguards liver cells from damage and early aging. It's a vital nutrient for maintaining liver health and promoting overall well-being. 12. Green vegetables. Green vegetables are excellent for liver cleansing, whether consumed as juice, raw, or cooked. They are packed with plant chlorophylls that help remove toxins from the blood and counteract chemicals and heavy metals, such as pesticides, thereby protecting the liver. Including foods like spinach, basil, lettuce, celery, and mustard greens in your diet can significantly boost bile flow and aid in detoxifying the body. 13. Milk thistle, silymarin. Silymarin, found in milk thistle, is a potent antioxidant that enhances the activity of key antioxidants in our body, such as glutathione and superoxide dismutase. Recent studies show that silymarin can nearly double the levels of these antioxidants in the intestines and liver. Glutathione protects cells from toxic damage and inflammation, safeguarding liver cell membranes and reducing toxin absorption. Milk thistle also helps counteract the effects of toxins on cells and aids their recovery. It's particularly useful for treating various liver conditions, including different types of hepatitis, fatty liver disease, and cirrhosis. 14. Turmeric. Turmeric is excellent for the liver. Simply adding it to lentils or other dishes can bring noticeable positive effects. Turmeric not only enhances flavor but also boosts liver function. Alongside turmeric, incorporating foods like asparagus, artichokes, and Brussels sprouts into your diet is beneficial. These vegetables are not only nutritious but also essential for maintaining a healthy and detoxified liver. Eating these regularly supports liver health and overall well-being. 15. Beets and carrots. Beets and carrots are a fantastic combination, loaded with beneficial nutrients. They are rich in flavonoids, vitamin A, and beta-carotene, which is also great for eye health. These nutrients work together to enhance the liver's functions and keep it active. Liver disease prevention, key steps beyond cleansing. It's essential to understand that cleansing the liver alone isn't enough to maintain its health. Here are other crucial preventive measures. 1. Stop harmful habits. Stay away from alcohol and quit smoking. Both can damage liver cells and lead to serious diseases. 2. Maintain a healthy weight. Keep your weight in the normal range, aiming for a body mass index, BMI, between 18 and 25. 3. Make diet changes. Cut out fatty, fried, and fast foods, and reduce sweets. Focus on a balanced, healthy diet rich in fruits, vegetables, lean proteins, and whole grains. 4. Exercise regularly. Regular physical activity is crucial. Being overweight can cause fatty liver disease, including the non-alcoholic type. Aim for at least 30 minutes of exercise most days of the week. 5. Consider genetic factors. If liver disease runs in your family, be extra vigilant about your health. Regular doctor visits and checkups are important, as liver diseases often don't cause pain and can be detected late. Always talk to a healthcare provider before trying any liver cleansing methods. Only a specialist can assess all risks and potential side effects. Is fatty liver dangerous? How can you recognize the early and advanced symptoms of hepatic steatosis, a silent yet serious threat? What are the key signs indicating that the fat in your liver has reached concerning levels? And more importantly, what steps can you take to eliminate this fat before it becomes too late? Today, we delve into the topic of fatty liver disease, a condition that is rapidly increasing worldwide. In the 1990s, hepatic steatosis was relatively rare. Nowadays, it is far more common than you might realize, even affecting children. In the United States alone, over 30% of adults over the age of 35 are afflicted. This is not a benign condition. Untreated, it can lead to liver scarring, cirrhosis, and even liver cancer. To grasp the severity of this issue, consider that hepatic steatosis is one of the leading causes of liver transplants globally. Ignoring this condition is not an option. Timely detection is crucial because the liver possesses a remarkable ability to regenerate, but only up to a certain point. By recognizing the signs and symptoms early, you can halt the disease's progression. Remarkably, you can even reverse fatty liver, restoring your liver to a healthy state. But it's not just about recognizing the symptoms. Understanding the main dietary causes of liver fat is essential. If you suspect or know you have fatty liver, avoiding certain foods entirely is imperative. I'll also share how you can naturally combat this condition through lifestyle changes. Surprisingly, some of the best remedies for fatty liver might already be in your kitchen, not in your medicine cabinet. So, let's get started. What are the 17 symptoms of fatty liver that you cannot afford to ignore? We'll explore 6 initial symptoms and 11 more severe complications, underscoring the urgent need for medical attention. First, a crucial point: hepatic steatosis is often silent. Many people discover they have fatty liver by chance during an ultrasound or a blood test conducted for another reason, where elevated liver enzymes such as AST and ALT are detected. This can be shocking, especially since early-stage hepatic steatosis does not exhibit symptoms similar to other conditions like diabetes, high cholesterol, or high blood pressure. But don't despair if you've been diagnosed with this condition. In its initial phase, fatty liver disease can be completely reversed, thanks to the liver's incredible regenerative capacity. So, were you really feeling nothing at all? Let's go to the symptoms. 6 initial symptoms of fatty liver. First initial symptom, stomach pain and heartburn. A study from UFMG revealed that individuals with hepatic steatosis often experience dyspeptic symptoms such as heartburn, burning sensations that extend from the chest to the throat, belching, and a persistent feeling of a full stomach. These symptoms occur significantly more in individuals with fatty liver, 25% compared to 12.4% in those without the condition. Second initial symptom, excess gas. Those suffering from hepatic steatosis frequently deal with excessive gas accumulation. Radiologists have noted that the presence of fat in the liver can contribute to this issue, sometimes even hindering the visualization of the pancreas during exams. This excess gas is likely due to changes in the intestinal flora, which directly impacts liver health. Third initial symptom, pain on the right side of the abdomen, near the ribs. This discomfort is often felt in the upper right quadrant where the liver is located, manifesting as a nagging pain under the rib. The liver's increased size can press on the phrenic nerve, causing pain around the right shoulder as well. Fourth initial symptom, loss of appetite. Loss of appetite among those with fatty liver can stem from metabolic changes, liver inflammation, and hormonal imbalances. Symptoms like nausea, abdominal discomfort, and psychological impacts contribute to a reduced desire to eat. These factors, linked to impaired liver function, disrupt the regulation of hunger and overall well-being, underscoring the need for medical follow-up and proper management. Fifth initial symptom, fatigue. The liver, an essential organ, plays a crucial role in metabolizing nutrients and generating energy. However, the presence of fat in the liver can significantly impair these functions. Moreover, steatohepatitis, a condition where liver inflammation accompanies fat accumulation, can intensify feelings of tiredness. This liver dysfunction also affects hormone production, impacting mood, sleep, and overall energy levels, leading to persistent fatigue. Sixth initial symptom, nausea. Nausea in cases of fatty liver or hepatic steatosis arises from various reasons linked to impaired liver function. The liver's reduced ability to filter toxins leads to the accumulation of harmful substances in the blood, causing nausea. Additionally, excessive fat in the liver can result in inflammation, bringing about abdominal discomfort or pain accompanied by nausea. Liver dysfunction also impacts digestion, particularly bile production, which is essential for fat digestion. Finally, liver enlargement can press on the stomach and other organs, creating a sensation of fullness and nausea. These symptoms reflect an inadequately functioning liver and typically suggest initial hepatic steatosis. Now, what are the 11 late symptoms of fatty liver that you cannot ignore? First late symptom, dark urine. In hepatic steatosis, the urine darkens because the affected liver releases more bilirubin into the bloodstream. This bilirubin is filtered by the kidneys and excreted in the urine, increasing its concentration and giving it a darker color, similar to cola. Second late symptom, white nails. White nails, also known as leukonychia, can be a sign of liver problems like cirrhosis or hepatitis. This change in nail coloration occurs due to changes in blood composition and circulation often associated with liver diseases. The liver's inability to process and eliminate toxins efficiently affects various systems, including the blood circulation under the nails, leading to pale or white nails. Third late symptom, red spots all over the body. When the liver fails to produce essential proteins for blood clotting, it can lead to a decrease in platelets known as thrombocytopenia and problems in the absorption of fat-soluble vitamins, including vitamin K. This deficiency is vital for clotting, and as a result, red spots may appear on the skin, signaling these hepatic problems. Fourth late symptom, spider veins. Hormonal imbalances caused by liver issues can lead to an increase in estrogen, which is not adequately processed. This excess estrogen causes the expansion of blood vessels, resulting in spider veins. This symptom indicates a problem with hormonal balance affecting blood circulation. Fifth late symptom, itching all over the body. In advanced liver disease, bile salts accumulate in the blood and deposit on the skin, causing intense itching. This itching is more common on the palms of the hands but can spread all over the body, causing significant discomfort. Sixth late symptom, jaundice. Jaundice occurs due to the accumulation of bilirubin, a yellow pigment produced by the breakdown of red blood cells. Normally, the liver processes bilirubin, but if there is liver dysfunction, biliary obstruction, or an increase in the destruction of red blood cells, bilirubin accumulates, tinting the skin and eyes yellow. Seventh late symptom, pulmonary erythema. Pulmonary erythema occurs due to the dilation of blood vessels in the palms of the hands. This characteristic redness can reflect various conditions, including hormonal changes or liver problems like hepatic steatosis. Damaged liver function leads to a hormonal imbalance causing blood vessel dilation. Eighth late symptom, pale stools. In hepatic steatosis, the liver doesn't properly process bile salts, which are essential for stool coloration. As a result, stools become paler, reflecting the liver's difficulty in performing its normal functions. Ninth late symptom, night blindness. Night blindness, or nyctalopia, can occur due to poor absorption of vitamin A, essential for eye health. The liver plays a crucial role in storing and metabolizing vitamin A. Liver disease compromises this ability, leading to a deficiency that affects vision in low-light conditions. 10th late symptom, gynecomastia. Gynecomastia, characterized by the enlargement of breast tissue in men, can be an indirect consequence of hepatic steatosis. The accumulation of fat in the liver interferes with the hormonal balance between estrogen and testosterone, leading to the development of feminine characteristics such as gynecomastia. 11th late symptom, pain on the right side of the abdomen, near the ribs. This discomfort is felt in the upper right quadrant where the liver is located. The liver's increased size can press on the phrenic nerve, causing pain around the right shoulder as well. This pain reflects the liver's enlarged state and underlying issues. That's why it's crucial to recognize the symptoms and address them promptly, even if you don't have any symptoms but possess risk factors for hepatic steatosis. How can you determine if you have fatty liver? Early detection of hepatic steatosis allows for complete reversal, safeguarding the liver from damage. Even when scars and fibrosis are present, progression to more severe issues like cirrhosis and liver cancer can be prevented. Diagnosis typically involves imaging tests such as ultrasound, CT scan, or MRI. While it's normal for the liver to contain a small amount of fat, exceeding 5% of its weight prompts noticeable changes in the images, indicating excessive fat accumulation in the liver. There are 3 degrees of hepatic steatosis: Grade 1, mild steatosis; Grade 2, moderate steatosis; and Grade 3, characterized by a large accumulation of fat in the liver. Who is more likely to develop fatty liver, and what are the risk factors? First risk factor, obesity. Obesity significantly increases the risk of hepatic steatosis, where excess fat accumulates in the liver. This excessive fat impairs liver functions and causes inflammation. Over time, this inflammation can worsen, leading to scarring of the organ. This scarring is worrisome, as it can progress to more serious conditions, including hepatic cirrhosis, severely compromising liver health and its essential functions. Second risk factor, type 2 diabetes. Individuals with type 2 diabetes face a higher risk of developing hepatic steatosis, a condition linked to insulin resistance, a central aspect of this disease. This resistance results in an abnormal accumulation of fat in the liver, negatively affecting its functions. This situation can progress to liver inflammation, increasing the possibility of more severe liver damage. Third risk factor, high blood pressure. People with high blood pressure have a higher risk of developing hepatic steatosis, as hypertension can contribute to the accumulation of fat in the liver. High blood pressure often coexists with other risk factors like obesity and insulin resistance, which together exacerbate the possibility of liver damage. Fourth risk factor, excessive alcohol consumption. Excessive alcohol consumption significantly increases the risk of hepatic steatosis. Alcohol is metabolized in the liver, causing oxidative stress and inflammation. This process leads to the accumulation of fat in liver cells, impairing their functions and potentially evolving into more severe conditions, such as cirrhosis and liver failure. Fifth risk factor, sedentarism. Sedentarism increases the risk of hepatic steatosis, as a lack of physical activity contributes to the accumulation of fat in the body and liver. Physical inactivity is also associated with other risk factors like obesity and insulin resistance, exacerbating the likelihood of liver damage. Other causes include the use of medications like amiodarone, diltiazem, tamoxifen, and corticosteroids. What can be done to reverse the fat in your liver? Essential steps to reverse fatty liver disease. First, exercise regularly. Currently, fatty liver has become a common problem in children, partly due to lifestyle changes. In the past, children remained active despite an inadequate diet, engaging in activities like riding bicycles. Today, the preference for electronic games has replaced actual physical activities. To combat this, it's recommended to engage in walks or other moderate activities for at least 150 minutes per week. Second, lose weight. By losing 5% of your weight, you can achieve significant benefits for your liver health, including reducing inflammation, fibrosis reduction, and decreasing hepatic fat, thus improving your overall health. Third, avoid alcohol. Reducing or avoiding alcohol consumption is essential to protect the liver. Alcohol damages liver cells, known as hepatocytes, and can lead to the accumulation of fat in the organ, compromising its function and health. Fourth, maintain a healthy diet. The health of our liver is closely linked to our diet. Often, an inadequate diet leads to fat accumulation in this organ. Fortunately, a balanced diet can be the key to reversing this condition. What are the 5 most toxic foods for your liver that you should avoid at all costs if you have fatty liver? First, ultra-processed foods. These include packaged foods and fast foods, which are detrimental to liver health. Avoiding ultra-processed foods is crucial to prevent fatty liver, as they contain high levels of sugars, saturated fats, and additives that increase the risk of hepatic steatosis. Second, refined wheat. Foods such as bread, pasta, and crackers increase fat in the liver. Avoiding refined wheat helps prevent fatty liver, as it can rapidly elevate blood sugar levels, contributing to insulin resistance and the accumulation of liver fat. Third, foods containing fructose. It's important to clarify that fresh fruits are not included. The biggest villain of all, causing the most fatty liver, is corn syrup and fructose, found in sodas, cereal bars, boxed juices, tomato sauce, ketchup, mustard, and jellies. Fourth, sugar. To maintain liver health, it's essential to reduce sugar consumption, including fructose. Sugar significantly contributes to fat accumulation in the liver, raising the risk of developing hepatic steatosis, a condition that negatively affects liver function. Fifth, vegetable oils. Today's diet is rich in omega-6, which causes inflammation, and poor in omega-3, which reduces inflammation. It's advisable to avoid vegetable oils, as many are rich in omega-6 fats, which in excess can promote inflammation and contribute to the accumulation of fat in the liver. And now, the 6 foods you should include in your diet to cleanse the fatty liver. First, turmeric. Turmeric, known for its anti-inflammatory properties, should be consumed with a pinch of black pepper to enhance its absorption and effectiveness in our body. Second, whole grains. Whole grains such as oat bran, flaxseed, and chia are rich in fiber and omega-3 and are associated with a reduced risk of hepatic steatosis. Third, coffee. Coffee, containing caffeine, tocopherol, vitamin E, and chlorogenic acid, acts as an antioxidant, reducing liver inflammation and offering protection against liver fibrosis. Fourth, olive oil. Consuming 3 to 4 tablespoons of olive oil daily can significantly reduce fat accumulation in the liver, promoting an improvement in liver health. Fifth, fruits. Research indicates that fruits, especially avocado, are effective in reducing liver fat. Avocado stands out due to its high content of glutathione, a powerful antioxidant that fights fat in the liver and promotes broader liver health. Sixth, cruciferous vegetables. Cruciferous vegetables like broccoli, Brussels sprouts, and cauliflower contain sulforaphane, which helps reduce liver inflammation and cancer risk, thanks to its sulfur derivative. Absolute worst food that you could consume for your liver. Especially if you're concerned about developing a fatty liver, and hint, it's not sugar. It's not carbs. And this particular ingredient is not even high fructose corn syrup, even though sugar, starch, and high fructose corn syrup are really bad for the liver. There's something much worse. The big problem with the liver is that there are very few symptoms that occur with liver issues. I had a liver problem for probably, 22 years. I didn't know it was a liver problem. I had some symptoms, but I didn't connect the dots. A lot of my symptoms were in my right shoulder, right through this trap right here, and right back into the scapula. Additionally, right underneath my right rib cage, it was always painful, sore, tight, and bloated for years. I didn't know what that was. This problem was related to my bile duct, the little tubes that connect to the gallbladder, which is part of the liver because the liver makes bile. I had this problem for a very long time, and that's why I do a lot of videos on the liver, because I completely reversed it. This brings me to a big myth that I want to talk about. People think that once you have a liver problem, you always have a liver problem. Absolutely not. The liver is incredibly robust and resilient. It's one of the only organs that can completely regenerate. Another myth is that the liver is filled with toxins and is very toxic. That's not true. The liver detoxifies poisons, it doesn't store them. Fat cells store poisons. The liver gets rid of toxins. Once the liver starts developing scar tissue and getting into cirrhosis, the risk of liver cancer goes way up. The treatment options the medical profession offers are not very good. It's often just a liver transplant, and you end up on a waiting list. There's not a lot of healthy livers available for transplants, so you're playing a waiting game, hoping you'll survive long enough to get a liver. Then, if you get a liver, you have to take anti-rejection medications like prednisone, which come with their own side effects. The simple solution is to prevent liver problems in the first place. There was an interesting study on rats that I want to tell you about. There were 3 groups of rats. In the first group, they were fed lard and alcohol. Lard is pig fat. The second group was fed beef fat, called tallow, and alcohol. The third group was fed corn oil and alcohol. What's interesting is that the first group, the lard and alcohol group, had minimal liver damage. The second group, with tallow and alcohol, had virtually no liver damage. This suggests that beef fat could potentially be protective to the liver. It's fascinating, especially since I consume a lot of beef fat in my diet, and I don't have liver problems anymore. But the third group, the corn oil and alcohol group, had severe liver damage. The worst food or ingredient for a fatty liver or a liver, in general, is seed oils. Seed oils are very inflammatory and damaging, especially the way they are processed. Seed oils, often misleadingly labeled as vegetable oils, are primarily composed of omega-6 fatty acids, particularly linoleic acid. These oils undergo extensive processing, leading to oxidation and the creation of free radicals, which are highly damaging to the liver and other tissues. Our diets are composed of far too much omega-6 fatty acids, between 25 to 30% of our calories. In contrast, healthier fats like lard, pig fat, contain about 2.5% linoleic acid, and tallow, beef fat, contains only 0.7%, while corn oil contains a staggering 56.6% linoleic acid. The issue with seed oils is that they get lodged in our cells and tissues, leading to long-term inflammation. Unlike sugars, which are metabolized relatively quickly, these fats stay in our system for 2 to 3 years. They get incorporated into cell membranes and hormone structures, creating chronic inflammation, especially in the liver, leading to insulin resistance and further complications. To improve liver health, the first step is to eliminate seed oils from your diet. This involves reading ingredient labels carefully and avoiding foods fried in these oils, particularly at fast food restaurants and many other eateries. Instead, focus on healthier fats, such as omega-3 fatty acids found in fish oils and certain plant oils. Omega-3s are anti-inflammatory and beneficial for liver health. In addition to changing your dietary fats, it's essential to incorporate foods that support liver function. Cruciferous vegetables like cabbage and sauerkraut are excellent for the liver due to their high content of sulfur-containing compounds, which aid in detoxification. Key dietary changes for liver health. Avoid alcohol. Reducing or avoiding alcohol consumption is crucial to protect the liver. Alcohol damages hepatocytes, liver cells, and leads to fat accumulation in the liver, impairing its function and health. Exercise regularly. Fatty liver has become a common problem even among children due to lifestyle changes. Engaging in physical activities, such as walking or moderate exercise, for at least 150 minutes per week is recommended. Lose weight. Losing just 5% of your body weight can have significant benefits for liver health, including reducing inflammation, fibrosis, and hepatic fat, thus improving overall health. Maintain a healthy diet. An inadequate diet often leads to fat accumulation in the liver. A balanced diet is key to reversing this condition. Avoid foods containing high fructose corn syrup and sugar, as they contribute significantly to liver fat. Avoid ultra-processed foods. Processed foods and fast foods contain high levels of sugars, saturated fats, and additives that increase the risk of hepatic steatosis. Avoid refined wheat. Foods such as bread, pasta, and crackers increase liver fat. Reducing refined wheat intake helps prevent fatty liver by managing blood sugar levels and insulin resistance. Avoid vegetable oils. Diets rich in omega-6 fats from vegetable oils cause inflammation. Replace these with healthier fats, such as those from grass-fed, grass-finished animals, and fish oils rich in omega-3 fatty acids. Foods to include for liver health. Fruits, especially avocados, which are high in glutathione, a powerful antioxidant that helps reduce liver fat and promote overall liver health. Whole grains, foods like oat bran, flaxseed, and chia are rich in fiber and omega-3 fatty acids, which are associated with a reduced risk of hepatic steatosis. Cruciferous vegetables, vegetables like broccoli, Brussels sprouts, and cauliflower contain sulforaphane, which helps reduce liver inflammation and cancer risk. Olive oil. Consuming 3 to 4 tablespoons of olive oil daily can significantly reduce fat accumulation in the liver. Turmeric. Known for its anti-inflammatory properties, turmeric should be consumed with a pinch of black pepper to enhance absorption and effectiveness. Coffee. Coffee contains caffeine, tocopherol, vitamin E, and chlorogenic acid, which act as antioxidants, reducing liver inflammation and offering protection against liver fibrosis. By making these dietary and lifestyle changes, you can significantly improve your liver health and prevent the progression of fatty liver disease. It's important to be proactive about liver health, given the organ's critical role in detoxification and metabolism. I had a liver problem for many years without realizing it. My symptoms included pain and tightness in my right shoulder and under my right rib cage, which I later discovered were related to my bile ducts. After addressing my liver health through dietary changes and lifestyle adjustments, I completely reversed my liver condition. This experience taught me the importance of recognizing early symptoms and taking preventive measures. The liver's ability to regenerate is remarkable, and with the right approach, you can restore its health and function. Preventing liver disease. Preventing liver disease involves understanding the root causes and making informed choices about diet and lifestyle. Seed oils, often marketed as vegetable oils, are a major culprit in liver damage due to their high content of linoleic acid. These oils are highly inflammatory and damaging, especially when consumed in excess. Replacing these harmful fats with healthier alternatives like omega-3 fatty acids from fish oils and grass-fed animal fats can make